Today's appointment we're going to be making final impressions. Since the last appointment we have made a set of custom trays from the primary impressions and casts that we poured from the primary impressions on the last appointment. This is the maxillary tray that has been constructed, and our object today is going to be to try this tray in the mouth and see that the peripheries are at the length we would like them to be. If they're not, we will need to adjust them. Likewise, we'll be doing the same thing with a mandibular, and this is the tray that we constructed for the mandible, and we are going to be fitting that into the mouth and adjusting peripheries. Following that, we will be perfecting all of the peripheries with a material called modeling compound. This is all done prior to actually making the final impressions. We're now going to try the maxillary tray into the mouth, seat it all the way, and judge the length of the periphery. And we see that it's a little long in the zygomatic process area and just relax your cheek, there we go, and just distal to the buccal frenum. So we will want to reduce the tray somewhat in that area. Then we will want to judge the labial, and we see it's a little bit long just to the right of the labial frenum. So we'll reduce a bit there. We look at the other side, and that appears to be in good shape. So we need to reduce basically two areas, along here and along there. I've marked on the tray areas that were overextended, and you can see it marked here in the left zygomatic arch buccal frenum area and a little across the right labial. And now what we need to do is to just trim that off to shorten it down to those marks. And now that we have them trimmed, we will wash all the debris off of it and try it back in the mouth to see that we have it at the proper extensions. Now that we have trimmed the tray, we can see that we've developed a 2 to 3 millimeter space between the edge of the tray and the peripheral roll of the tissue. And let's observe the labial, and we have the same thing. We have produced a 2 to 3 millimeter space, which is adequate for our border molding. In order to perfect the peripheries of the custom tray, we use a material known as modeling compound. Modeling compound is a stick of material that is thermoplastic. It can be heated in a flame, and when you heat it in a flame, the surface of it becomes extremely hot, even though internally it is not that hot. So we have to use a water bath at 128 degrees Fahrenheit in order to dissipate the surface heat that's within the compound. So what we'll be needing to do is, with the compound, we will have a definite set 1, 2, 3, 4 type action that must go in the particular sequence. The one thing that I would like you to really remember, though, that whenever you use compound, you never touch that compound or place that compound in the patient's mouth, or touch it with your fingers even, unless it is coming directly out of a 128 degree Fahrenheit water bath. The stick compound that we use, this is the stick compound, and it must be, its working temperature must be 128 degrees. So we have the water bath set at 128 degrees. It's just a bath of water. We also have a Bunsen burner going, in which we're going to, so to speak, soften this compound so that it's usable. And then in addition to that, we have one other thing, and that is the torch, the hand-out torch. And we use this for making sure that the material is soft as we would like it to do. So what we're going to do is we're going to soften this compound by constantly rotating the material just over the flame. And we'll get that material very, very soft to the point to where it actually looks like it's going to drip. And it'll get very, very soft. If you get a little bit too much heat, you'll see that happen to it, but that's of no consequence. Then we apply that softened material to one section of the tray. I usually do that one section of the tray from a hamular notch area all the way up to about the buccal frenum area. And so we form it like that after wetting the fingers so that we can form the material. Once we've wet the fingers and formed the material up like that and build it up in that fashion, then we're going to take our Hanau torch and we're going to soften this material once again to make sure it is nice and soft. Now remembering that material is super hot on the surface. So what we're going to do is we're going to temper the material for about 3 to 5 seconds in the water bath, and then from there we will be going to the patient's mouth. When the material is thoroughly softened, we're ready to go to the patient's mouth. So we rotate the tray into the patient's mouth, make sure it's seated all the way. Then we ask the patient to move their chin from one side to the other. Then once that's done, we grasp the cheek like so and pull it out and down and anteriorly and posteriorly. And once that's done, you'll see that we have border mold one section of the tray. We can see that we got a good border molding of this left area of the tuberosity area, zygomatic arch, and the buccal frenum. Now, this tray will actually take 4 applications of compound to totally border mold it. The second application will be a similar one on the patient's right side. The third application will be across the labial, and the last application of it will be across the posterior palatal seal area from hamular notch to hamular notch. Another way of softening the compound in order to apply it to an area is to heat the tip of the compound directly in the flame and then smear the compound onto the edge of the tray. Some operators like this better than trying to heat the entire end of a stick of compound. I think that's personal choice, frankly. I do it both ways. I don't think it makes an awful lot of difference to me. So we wet our fingers after the compound's been applied, and we build it up onto the periphery like so. Then we take our torch and we superheat the compound to make sure that it is very, very soft. Once the compound is superheated and it's very, very soft, then we give it that 1, 2, 3, 4, or 5 second. So now we're going to the mouth with it. Rotate it into the mouth. Swing the chin from one side to the other. Very good. And relax your cheek and lips, and I manipulate the cheek and lips. And then we have our border molding done on the second portion. Okay, border molding, the third section of it will be across the labial from from buccal frenum to buccal frenum. So we're going to heat the compound in the flame, get it very, very soft. Doesn't matter which technique you use, in the flame or off or above the flame. And we'll heat the compound and apply the material to the periphery. Once it's applied to the periphery, then we can wet it, wet the fingers, mold it up a bit, to build it up just a little bit. They stand up on the periphery some. Once we've done that, we take our Hanau torch and again heat the material till we know it's particularly soft, and watch the areas where it's joining another section that's previously border molded to make sure it blends in well with it. Once it's superheated with the torch, we temper it again for 3 to 5 seconds. Then we go to the mouth, seat the tray all the way, and this time we want to border mold each buccal frenum area on left and right sides, and for the labial we're going to just pull the lip straight down. And there we have our border molded tray, all except the posterior palatal seal area. The fourth section that we need to apply compound is across the posterior part from hamular notch to hamular notch. In this application of it, however, we do not want to lengthen the tray as far as its length is concerned. We want to place the material on top of the tray so that when this material is placed in the patient's mouth, it will displace some tissue. So we just add the compound. Well, add compound to the tissue surface of that. And now what we're going to do is we're just going to superheat that material. We don't even need to build it up with our fingers like we did with the other sections of it. We temper, and then we go to the mouth. And the only thing we do with it this time is to seat it and put a little pressure posteriorly on it so that it will displace some tissue. Now that we have finished our border molding, we can examine it and see that we have picked up all of the anatomy all the way around. Good border molding will always show that the periphery is nice and rounded without tray showing through. If it comes out knife edge, that means that the material is short. If it comes out with tray showing through, that means that our tray was too long and it needed further trimming before we did our border molding. So we can see that this came out very nice and rounded, no tray showing through all the way around. It has a very nice replication of the labial frenum. And we have a nice rounded periphery all the way around without any tray showing through. Across the posterior from hamular notch to hamular notch, we have displaced some tissue by adding this compound in this area. Now what we need to do is to eliminate excess compound that may be in our border molding procedure, and we can see that this has a fair amount of excess compound in this area where it is creeped down on the inside of the tray. So we have a fair amount of that excess compound here. We have a couple of other spots around here where a little bit of the compound is creeped down within the tray. So what we're going to do is to take a Bard Parker knife with a very sharp blade and trim this excess material from the inside of the tray. To trim the excess compound from inside of the tray, you need an extremely sharp knife. So I like to use a Bard Parker red handle knife like this with a good new sharp blade in it. And all we do is trim these vertical walls to get the excess material that's creeped down on the inside of the tray, to get rid of that material. Now that we've trimmed the excess material from inside of the tray, we need to rinse the tray, get rid of any extraneous material, the little chips is in it, dry it, and paint it with the proper adhesive to be used for our final impression material. The material that we're going to be using to make our master impression, the impression material, is a polyvinyl siloxane material. Its brand name is Aquasil Monophase, and it's produced by Dent Supply Company. The polyvinyl siloxane material that we use for our final impression requires an adhesive. The adhesive that we use for this is Caulk's Tray Adhesive, manufactured by the Caulk division of Dent Supply Company. We do not like to use the brush that comes with the adhesive in the bottle, and the reason for that is that the tray that we're going to be painting with the adhesive has been in the patient's mouth, and that would cause a contamination problem. So what we do is that we take the adhesive itself and pour it into a medicine cup and use a very small, or use an acid brush, which is a very cheap type brush, to paint the material into the tray, and that way we can throw that brush away without contaminating any of the material. The apparatus that is used for dispensing mixing and dispensing the polyvinyl siloxane with Aquasil consists of some tubes of the material which must be thoroughly mixed, one portion of the material with the other portion of the material. This cartridge is put into a dispensing device that's much like a gun, that when we have it loaded we can squeeze this handle and it will dispense the material, mixing the material through an auto mixing type of tip. The dispenser for the material is a gun-like device, and in order to use it there's a little gate at this point that needs to be rotated up all of the way. There's a little lever at the bottom and underneath the plunger of this gun-like device, and if you push that lever, pull the plunger all the way back. Once the plunger is all the way back, we can load the cartridge into the gun. The cartridge has a little slot in the base of it right here, and that must go down as you load the cartridge. So we load the cartridge all the way into the dispenser, reclose that gate that we lifted before. Now we're ready to add the dispensing tip, and the way we do that is to take the little protective cap off of the front of the carpules. We take a dispensing tip and we put the dispensing tip onto the end and twist it like that till it's locked in position. Then at that point we can operate this trigger-like device, and we can see the material coming through the mixing tip. And we're going to load the tray now with the material. I usually like to put 2 or 3 rows of the material onto the tray. And then place the material into the pallet. About that much should be an adequate amount, I would think. And then we take a tongue blade and we smear the material across the pallet, just to making sure the tray is loaded properly. And then we drag the material from the ridge up onto the periphery all the way around. Now we're ready to go to the patient's mouth. Now we insert the tray into the patient's mouth by rotating it into the mouth, and when we get it in position centered, I like to turn loose with my forefingers and seat the tray with my middle fingers, using the forefingers and the thumb to pull the lip and cheeks all the way out of the way as we seat the impression. Once the impression is seated, now we must go through all of the border molding procedures that we did with compound, which means we have the patient swing the chin from side to side, and then relax the lips, and then we border mold right and left buccal frenums like this, and for the labial we just pull it straight down. I usually do that in almost a continuous cycle through 2 or 3 cycles. And then the material by that point usually is set enough to where it is not going to move. And we can allow that to just relax, allow that material to set all the way usually takes 3 to 4 minutes for the material to set. Another way of checking for the set of the material is to lift the lip and take a fingernail and poke the material. And if it rebounds all the way, the material is set. If it doesn't, such as what we have right here, see, that didn't rebound all the way, and that material is not quite set. When you think the material is finally set, if you'll poke it again with a fingernail, try the fingernail on it, and we see that that does not leave a fingernail imprint on it now, that means that material is totally set. We can now remove it from the mouth. So the way we do that is just to work the cheeks just a little bit, and then remove the impression from the patient's mouth. We can see we have an excellent impression in that we have nice rolls on the peripheries. They all look very nice and rounded. There are no problems with the peripheries except a very small little bubble right there on the right distal buccal space. That's so small I would not redo the impression for that. Much like the procedures that we did for the maxillary impression, we must do those same procedures for the mandibular impression. The only difference in it basically is that instead of having only facial and labial surfaces to deal with as we had on the maxillary impression, we also have the lingual surfaces to deal with. So what we're going to do again is we're going to fit this tray to the patient's mouth before border molding. So we rotate the tray into the patient's mouth, get it seated all the way, and then we want to examine the peripheries and see if those peripheries are too long. And as we can see, when we move the tissues, the cheek, that those peripheries are touching the peripheral rolls, so therefore they need to be shortened. The same is true across the labial, in that it's a little long. As we can see, it interferes with the movement of it. And the same is true of the right side. As far as the lingual ones are concerned, just set your head back, please. That's done strictly by feel. If you would put your tongue straight out at me, and that feels very stable. It's not moving the tray. So that has to do with the design of the lingual flange, accounting for the anatomy. Now that we've evaluated the length of peripheries, we found that all of the linguals were of adequate length, of the length that we would like them. We were going to mark onto this tray the areas that need to be reduced. And we found that basically all of the facial peripheries were overextended in that they interfered with the movement of the lips and the cheeks. And so we're going to shorten those down about 2 to 3 millimeters all the way around. Once we've marked them, then we're going to take a handpiece, a slow speed handpiece, and we're going to trim these peripheries. Now that we've trimmed the tray, we're going to try it in the patient's mouth and see that we have a space between the tissues and the peripheral roll. And there seems to be a good space on the left side, across the labial, and a little bit on the right side. We apply the compound just like we did on the maxillary one by heating the compound in the flame and smearing that molten compound or melted compound onto the periphery. I usually do this in 6 sections. We'll do both distal linguals from about the first molar or second premolar region posteriorly up to the retromolar pad, about that much material. Once we've got the material on there, we wet it in wet fingers, and with the wet fingers build it up like so. Then we take our torch and we superheat the material so that it's nice and moldable. We temper the material in the 130-degree water bath for 3 to 5 seconds. Then we go to the patient's mouth. And we rotate it into the patient's mouth. Now I would like you to stick your tongue straight forward for me. That's good. Now put the tongue in your right cheek real hard. Good. Now relax. This should give us a nice rounded periphery from the retromolar pad down the retromolar curtain area into the post-mylohyoid space area or retromylohyoid space area and up through to about the second premolar on that side. To do the opposite side now on the distal lingual, we're going to do exactly the same thing. We're going to smear the compound after it's melted in the flame, smear it onto the periphery from about the second premolar area up to the retromolar pad, getting all of that distal lingual, including the post-mylohyoid space and the retromolar curtain, into it. So we dip it in the water, wet the fingers, build it up with the fingers. Then we take our torch and we superheat it to make sure it is good and soft. Once that torch has been, the material has been heated with the torch, then we're going to go back to the mouth again and we're going to rotate it into the mouth. Place your tongue straight out at me, good, and into your left cheek this time. Very good. Now relax. And again, we have a good border molding in that we have a very nice rounded periphery without tray showing through. It's an excellent border molding at this point. The next procedure that we need to do is to finish out the lingual, the sublingual crescent area from second premolar around through second premolar. We superheat the material with the torch 3 to 5 seconds in the 130-degree water bath. And now we go to the mouth, seat the tray, and this time I would like you to put the tip of your tongue where your upper 2 front teeth should be and press the top of your tongue right against the roof of your mouth. Very good. Now relax. And now we have a very nice border molding of the sublingual crescent area. The facial surfaces on the mandibular are identical to what we do on the maxillary, except we're doing it upside down. So we soften the compound in the flame, and we take it from about the second premolar area around to the retromolar pad. Wet the material in the compound heater, mold it with your fingers, and then we take the torch, superheat it again to get it nice and soft, uniformly soft. We do a 3-second dip in the water bath, and now we're going to the patient's mouth. We rotate it into the mouth. And this time we grasp the cheek with the thumb and forefinger and pull it up, backwards, and forwards. And here we have a very nice border molding of the distal of the retromolar pad, the masseter muscle region, and the facial region from the retromolar pad up through about the buccal frenum area. And now we're going to border mold the right posterior area, which is the same as what we did on the left. And we pull the cheek up and anteriorly and posteriorly. And that gives us a nice rounded border molding from the retromolar pad through about the buccal frenum area. And now you notice we've got all the compound around the labial, and notice we still have left a little bit of that 1 stick of compound that we used for border molding the entire lower. It doesn't take several sticks of compound to border mold 1 tray. 1 usually will do it. So now we're going to superheat the material again. Get it nice and soft. Temper it 3 to 5 seconds. And we take it to the mouth. Seat it. And with it seated, I'm going to border mold the right side a little bit and the left side a little bit, and then pull the lip straight up and in. Now I would like you to suck that lip up and in for me. That's good. Relax now. Everything should be good if we got our border molding correct. And yes, looks very nice. Now what we need to do is to trim from the inside of the tray any extraneous material which might produce a pressure spot on the final impression. As an example, on the retromolar pad and on this lingual surface through here, and somewhat a little bit of this facial surface is here, and the same on the other side. A little bit on this lingual surface here and the retromolar pad area. So we're just going to trim that with a good sharp knife. You need to make sure that you trim it back off that retromolar pad enough that when you make the impression, that retromolar pad is not distorted by your tray or the compound. And again, there's a little bit of it coming down on the inside of the tray right there, and again the retromolar pad. And in fact, if you happen to lose, by trimming this, the little bit of retromolar pad peripheral molding here, that doesn't really matter. That will pick up quite nicely if you do lose some of that in the process of trimming it without having to go back and reborder mold it. That's probably the only area that I would not go back and reborder mold it, but that one you can. If you do lose it, it's of no consequence. And now our tray has been trimmed, the compound's been trimmed, and at this point we're ready to apply an adhesive to the tray in order to make our final impression. Now we're ready to paint our tray with the adhesive. And so as we paint it, we're going to paint all the internal surface of it with the adhesive. And in addition, we're going to make sure that that adhesive is applied not only to the tray, but to the compound also, because the material needs to stick to the compound as well as the tray in making the impression. Okay, so we're painting the tray, getting a nice coating of it, making sure that we get it up onto the compound and the peripheries. After painting the tray with the adhesive, I like to let that adhesive set for about 3 to 5 minutes before loading the tray with the final impression material. We're now ready to apply the impression material to the tray, but before applying the material to the tray, I always like to squeeze a little bit of the material out of the mixing tip. I'll just get rid of that little bit for fear that that might have already started to set. And now we're going to just apply the material to the tray. I usually put about 3 layers of this material, or strings of it, whatever you want to call it. Once we have the material into the tray, take a tongue blade and spread the material, making sure we get it up onto the peripheries nicely. And once the material is spread onto the tray, we're ready to go to the mouth. And we rotate the tray into the mouth, Put your tongue out at me, please. Now relax the tongue, and we're going to seat it. And now I'm going to border mold continuously each buccal, the labial, and the lingual. Now put the tip of your tongue straight out at me. Put it into your left cheek, into the right cheek, straight out again. Now just let it relax on top of it. And I usually do this continuously until I feel that the material is no longer going to run. Tip of the tongue straight out, right cheek, left cheek. Now put the tip of the tongue where your upper two front teeth should be and press with the base of your tongue. That's it, good. Relax now. I think the material is now set sufficiently to not go through any more border molding procedures. It's just a matter of allowing the material to totally set now. Now in order to check to see if the material is totally set, if you take a fingernail and just poke the material, and if it totally rebounds after you poke the material like that, or put a fingernail print into it, then the material is set sufficiently. You don't need to leave it in there anymore. So we can remove the impression and examine to see what we have. We see that we have a little tray showing through on the distal lingual on the patient's right side. We also have a little tray showing through on the patient's left side. We have a little bit too much pressure in the area of the premolars here and across this labial. So I will want to redo this impression because of those pressure areas would be detrimental to the final fit of the complete dentures. Okay, now that we've made corrections on the impression, let's see if see what we have now. And yes, we have a very nice impression now. We have a slight little crease in the material right here, but I don't think that'll be of any consequence to us. We have beautiful peripheries on the buccal all the way around, showing our buccal notches for the buccal frena, showing nice coverage of the retromolar pads, showing the notch that the masseter muscle will make into it, and a nice periphery all the way around. So this is a very acceptable impression. Now that we have an acceptable impression, the next thing we need to do is to disinfect the impression with a surface disinfectant. So we spray it real good with a surface disinfectant and place it in a bag for transportation to the laboratory for pouring.